of the stuff that's been going on. All you need to do is hit that subscribe button and just wait for about 30 seconds and you'll be able to join in. But please be respectful and don't be a troll or we'll chuck you off and you won't be able to comment anymore. We have the power to do that. So, Phil, tell us what. I was going to start off by talking about the NHS. Obviously, we've got other things that we can cover. So, yesterday we had Keir Starmer, now our Prime Minister. He keeps forgetting, but he is the Prime Minister.
Yeah.
And he said that with the NHS, it is reform or die. Some people took that as a threat, like he was going to kill the NHS if it wouldn't reform. But I took it as like, if they don't reform, they will die. What was your take on it?
It is a fact because, like, the Conservatives kept saying, for example, we're piling all this money in, and it's like, yeah, but you haven't actually increased like productivity effectively. You haven't increased outcomes or reduced waiting lists or anything like that. Now, from the Tories' point of view, that suits them down to the ground because they want to give the impression that the NHS is this bucket with multiple holes in it, and the more money you pour in, the more that just leaks out. And that's why we should have, a private healthcare system. You know, you've got like Winston on, the gynecologist, saying, Labour, don't want to talk about this, but we actually maybe have to start talking about some sort of privatised insurance or maybe
is that the gobshite with the big moustache? Him?
No, he's good at what he does. He's a good gynecologist, but
he's a massive turf, isn't he? Isn't he?
I don't know about that. I don't pay attention to people like when they've got. He's a gynecologist. He knows his shit as a gynecologist, but you don't necessarily listen to him for his political views. Everyone has political views.
Yeah, you don't have to be a gynecologist. You don't have to be a gynecologist to be able to spot a.
Well,
see you next Tuesday.
But nonetheless, I mean, this is obviously not at all what Labour want. And the report, which, although you could say, well, this is a report by someone independent, it sort of was and it sort of wasn't. It was by someone who'd worked closely with Labour, indeed was a former Labour health minister. And in fact, the BBC are running an article at the moment saying he'd come up with some of these same ideas himself as that health minister. But that was in 2007. Obviously far too late. Even, it doesn't matter whether the Labour government would have taken it seriously or not. They were out of power a few years later, so it made no difference. But it is a fact at the moment that, what they'll say is the amount of funding that's going to the NHS is going up. Now, I would argue that if you were to break it down to where the funding's really going, it might help point out some of the problems. How much, for example, is going into private companies? Because if you're sort of giving money to the NHS, but then telling them to subcontract something out to a private company, it's not really NHS money, is it? You're just getting the NHS to mule money. And there's all sorts of things like that. And the report itself said there's too much money was spent on secondary care, not enough on primary and community care. Yeah. So there's an expectation that sort of that reverses. So there has to be reforms. But yeah, there is. See, it cuts both ways, this idea. And I know it wasn't Starmer himself, but it was someone in Labour, wasn't it? I can't remember who it was. As in, I saw the name and then didn't know who it was. But someone was like attacking the GMC, the General Medical Council, as being too conservative themselves, don't like change type of thing. And it cuts both ways. There will be an extent to which that will be true. There are a lot of people who have a particular way of working and they don't necessarily like it, because Labour are not talking about, for all this talk about, you're just planning on tinkering. It's like, no, they're not. They're absolutely not planning on tinkering. Now so they're planning on massively changing things. And when you massively change things, first of all, there's no guarantee that what they're going to change it to is the best thing to change it to. There's not even a guarantee it will be better. It's probably going to be better. There's a fair bet it's going to be better. Yes, there's a fair bet it's going to be better.
On the grounds that it couldn't be much worse, Phil. I mean, the NHS under the Tories, they just ran it into the ground. They went from the health system with the highest level of satisfaction in the world in 2010 at the end of the last Labour administration to this new administration coming in. I'm picking it up where it is the least appreciated.
I can give you
system in the world.
Like a little story as well. It happened to my stepdaughter, and I've talked about this before. It's got even worse now. So she was in hospital. She's a young lady. She was in hospital a couple of weeks ago, for quite a long time, severe pain, They looked, first of all, they checked for appendicitis. Oh, there's no appendicitis. And then what the doctor had said to her and her mother was, oh, yeah, we couldn't see it, but that's a good sign when you can't see the appendix. That's actually a good sign. It's like, okay. But then the medical notes, which they didn't actually relay to the patient or her mother, we only know because they've been picked up by a GP now, is the reason they couldn't see anything on the scan was because there was so much gas. And there were huge warning signs, but they did nothing about it. They left her in hospital in severe pain for a week and did no further investigations. So as soon as she came out of hospital, she researched herself and she got a scan done privately, and that has picked some things up. But now what's also happened is because she's now gone to a GP who's taken it seriously, because both she and her sister have severe medical problems, but they're not being diagnosed because doctors keep just saying, oh, they're young, they probably just got menstruation, they don't realise, or something stupid. So they give them the brush off.
There's
but this
a lot
GP
of
is taking it seriously.
in medicine, isn't there? Like,
no, I'm sure it's not deliberate. Well, some of it will be.
Some of it
there'll be real misogyny.
There's a book called Invisible Women, where the author talks about this, although she might also be a TERF. But some of the things that they talk about in that are fascinating. Like tests being done on blood, but it was only ever male blood that the tests were done on till fairly recently. And so like crash test dummies were always around the physique of men rather than women. And as a result, around the world, thousands of women died in car accidents when they didn't need to, if the seatbelt had been designed around the physique of, adjustable.
I mean, things like that will be like thoughtlessness rather than deliberate. No one will have sat in a meeting thinking, oh, should we design a crash test dummy around the women's physique? They just won't have thought about it, I strongly suspect. Yeah,
but that's because most of the people involved were men.
Yeah, most people involved were men, exactly.
Nearly all buildings are designed by men. That's why everything we design these days all looks like a penis or is incredibly ugly or both. And there's never enough room for the women's toilets. Ever. In any building. It could be a brand new building, and if there's an event on, there will be a queue for the women's toilets, but not for the men's. Wembley Stadium is fucking mad for that. Like, Wembley, brand new stadium built for their new millennium, and they don't have enough space for the women's toilets.
So anyway, what's happened now is they've done tests properly, and they've found that her liver functions. So now she's shitting herself that it might be bowel cancer. I mean, there's no...
Oh, shit.
They're not saying it is, by the way. That's her just listening to the list of things they're investigating, and she's picked out the worst one, as you would. And so, but now she's scared. And you just go back to the fact, the only reason this is happening, the only reason she's now, and we keep trying to say to her, but now that they're finding things, that's actually a good thing, because you have this problem, now they're finding things. But there she was in hospital in pain, and they weren't even making an attempt
to
investigate what it was.
Yeah.
They did one thing. They did one thing, couldn't see anything, and it wasn't for the reasons they said. So they lied. They actually lied to her about what they found.
Oh, mate.
So obviously, we keep saying she needs to put a serious complaint in about this. Yeah. Because that's, even the GP that's under it saying you need to put in a complaint about that. But that is part of the problem that we have in the NHS. It's not a place where you can go and because what should happen? You go in with a particular complaint, and you look for you consider the symptoms. You think, what's the most likely thing it is? Do a test for that, negative. Right. So what's the next one on the list? Do a test for that, and you keep going until you have diagnosed it.
Yeah.
You don't stop. You don't just we looked for this one thing, couldn't find it, so we just stopped. Because then people, and that's what Labour are sort of pointing out in a roundabout way, that when you've got people who are not being treated quickly and effectively, there's an economic cost to that. Yeah. It's a bit like when Rachel Reeves was justifying, not that she would have to justify it to us, but just generally justifying the public sector pay awards. She said there is a cost to not settling in strikes, in the fact that you struggle to recruit. We have shortages in public sector jobs. And if you want to recruit, you need to offer more attractive wages. And if you don't want them to strike over pay, make sure you're being fair with pay. And the same thing applies to healthcare. If people are not being treated properly. So this now, even if it turns out not to be super serious, and it's still something that's been investigated and she's going to need treatment for. And she's just about to, start again at university this year. So it delays that. If she was in work, she'd be having to have time off work. And This is the cost. There's an economic cost to not dealing with healthcare properly. But all the Conservatives want to say is, oh, we throw loads of money at it, loads of money. No one cares about how much money you threw at it, mate. They care what the effectiveness of it is. Yeah. It was your job to make it effective, and they didn't do. So now Labour have to. And because it's got so bad, yes, there's going to have to be serious reforms. Yes, the reform or die can sound like a bit of a threat, and some of the other things can. And it does cut both ways, because maybe some of the reforms, because Keir Starmer's made it crystal clear, he's got his plan and he's absolutely going with it, and he's going to ignore anyone who wants to be a blocker. What does he call it? A progress inhibitor or something like that, I think he called it. And it might be that some of the people may actually have a point in some areas. But yeah, we'll just have to see.
Yeah.
We will just have to see what happens. But yeah, like you say, it's spectacularly unlikely in a few years' time. In fact, Wes Streeting has said the waiting list will be reduced by millions before the next election. Now, you would expect that anyway, because the NHS is going to be a big part of their next election campaign, as you would, it has to be. Yeah. And that is one of the most visible signs of progress. Can you get the waiting list going down? But by saying it'll have gone down by millions, he's basically saying it will have gone down a lot.
Yeah. Can you still hear me?
Election.
Can you still hear me, Phil?
Yes.
Oh, good. Sorry, I changed something. I was worried that you couldn't hear me. We've got some comments coming in the chat. We've got Phil saying, need to put a stop to physician associates, a disaster waiting to happen. G. Whistler saying, Labour MPs have received considerable donations from private healthcare. They want to return. Siskin Edge says the NHS as a proportion of the government budget has only climbed since 2010 and is while getting worse. But I mean, one of the reasons why it's climbed as a proportion of government spending is because government spending in other areas has been cut to the bone.
Yes.
And Donna's saying costs for materials using cancer treatment and for radiotherapy has gone through the roof since Brexit. I doubt many people understand the issues of cost for the NHS.
Well,
and that's
true. What's been said. A lot of the money has been swallowed up in day-to-day running costs. So, but what the Tories never do is fund.
One of the reasons.
Well, in the last few years, certainly. But what the Conservatives never do is invest in research and development to make things better. They only ever cover running costs.
Yeah.
So inevitably, that's where all the money's now gone, because we haven't improved the NHS since basically 2010.
Well, and also you've got some issues with the private public funding of some of these hospitals when they were built under New Labour back in 1997. One of the big problems and the legacy problems that we've got is these private companies that built these hospitals were given contracts to say that they could continue to supply the building with, let's say, light bulbs, and they've got a monopoly. So the cost of changing a light bulb has gone up from what it should be, a couple of pence, to literally hundreds, and in some cases, thousands of pounds to change a freaking light bulb, and they bill the government for it. Here we are, 25 years later. Not the best scheme, I don't think. And there's a few dozen hospitals that are suffering at the moment because of this. And I think this is something that this Labour administration needs to really seriously address and say, this is ridiculous. We're not paying 10 grand for a bloody light bulb. I know that's exaggerating a little bit.
That's the thing. I mean, in terms of PFI, so that was one of the things I sort of most opposed at the time. Now, I am going to have to, just to be devil's advocate, point out the sort of political side of it. So my attitude was that Blair was just too personally in favour of PFI. It would have been different if Labour had seen it as a bit of a necessary evil, because you can see that argument. So here's the scenario. You've come into power, just like in 97, you've come into power and the NHS is in need of major investment, just like now. But if you borrow because the way I look at it, the reason why I can try and explain to a voter why PFI is bad is I would say, look, if a private company thinks it can make a profit by delivering this service in the NHS, then anyone can. Any investor can. That includes the Treasury. So the government could put that investment in, and then there is no profit. So actually what there is, the costs are just kept down because you don't need to make a profit. And if there were a profit somehow, then it's coming back to the Treasury, which funds the NHS anyway.
Yeah.
So it's not going to like people who are just spending it on yachts or chucking it out the country.
Yeah.
So if a private company can make a profit doing a thing, then so can the government. But the political reality is that what people don't want the government to do is because you'd have to borrow for it. Now, they accept a certain level of borrowing. In fact, it's quite interesting. There was a bit of a survey done recently just to show the limits that people will take.
I've got a question about this, but can I just go to Gary DeSantis's £5 super chat first? Thank you so much, Gary. That's very kind of you. I cost £500 per week as a community nurse. It's £500 per day, not per week, per day, to admit to hospital before treatment. Go figure. So yeah, making a really good point about prevention being better than cure and making sure, that we have the most cost-effective way of dealing with people who when they're not well. It's not what we're doing at the moment. It is absolutely ridiculous, the situation at the moment. So go on.
So the thing with PFI, so the sort of
borrowing. Tell us why borrowing is bad. Who are they borrowing off? Phil, who are they borrowing
off? Because what happens is...
Phil, are they borrowing
off...
Are they borrowing off the Chinese? Who are they borrowing off?
Yeah, as far as voters are concerned, that's exactly who they're borrowing off. We know they're not, but that's exactly what... So what happens is the government borrow a load of money, so the national debt goes up. All the papers point out the cost of servicing that debt. They never say, but we're actually getting a return. The return is never factored into it. So... think about two types of borrowing in that most people will do in their day-to-day lives. So there's the amount of borrow. So you borrow to say do your kitchen up, right? That's just so you borrow say £25,000, but you're going to pay back say £45,000, let's say over the term of it, whatever. So that's how people. That's one type of borrowing, and that's the type that the government, the newspapers will say it is. The other type is a business borrows £200,000 to expand some part of their business. Yeah. And over the next 3 years, as a result of it, they make £500,000. So they pay off the loan plus the interest. They've got a bit extra. And then that expansion to their business carries on for years ahead. Yeah. So that's where you get a return. That's not the way it's described in the media. So it is a fact that people think of government. And in actual fact, government debt is not like either of those anyway, but it's much more like the second one if it's for capital investment. But the public don't see it that way. And the reason they don't is because the media what they will do is they will instantly calculate how much it costs to service that debt, assuming there's no return. They always base it on the fact there'll be no return. So they work out how much it'll cost and therefore how much your taxes will have to go up. So the public think, so the more you borrow, the bigger that figure is, the scarier it is, you lose the election.
This is so infuriating. Yes, nobody thinks that someone is bad with money if they get a fucking mortgage. Yeah, can you afford this? Can you afford this £450,000 home?
Yeah, but
today?
They think it's a mortgage.
I'll take out a loan, and then at the end I get a...
But the way they think about it is, it's like you getting a mortgage for someone else's house. That's how they think about it.
But it's not.
So that's the political reality. But so you have a situation.
Phil, but also, can't they make the argument that actually by investing in the NHS, by investing in public transport or education, we're saving money down the line? So it's all offset.
Who should make this argument?
The government, the Labour government.
Okay, so the government make that argument. This is a government, by the way, run by a party that's really bad at communicating to the public. So they make this argument. And then literally every newspaper, even though they're basically owned by like 3 people, but every single newspaper that looks like it's all different sources all says the opposite. So that's the reality. You've got this load of money that needs to come in to turn things around. You need the investment. You can't get it all from borrowing because you lose the next election. So I sort of, although I hate PFI, I am going to add this caveat.
Phil, do you see that as still valid though in this day and age? Because you get on Newsnight, you get your MPs on Question Time, whatever, and you say this. You say we are going to save money by people not taking X amount of days off work because they're ill, and then that'll be clipped up and that could be shared around.
Don't work because it's all from one source. They all know. They all know it's from one source. And also, as will probably come up later on in this show, MPs are idiots and they're really crap at arguments. But it's one source. Everyone else, and the Express and the Telegraph and the Times and everyone else will quite happily trot on professors and all the rest of it. who will say the opposite.
Yeah, but it doesn't matter because the people who read those newspapers don't vote Tory. They don't vote for Labour anyway. So
they do, and it's not just having to read those newspapers.
20%, 20%, Phil. We don't need
everywhere.
them.
It's everywhere. It's everywhere. They're on social media. They're everywhere. The Daily Mail is like because people keep talking about falling distributions of newspapers. Yeah, but what about their online stuff? That's rising quite a lot. A lot of people. And the Daily Mail, you don't have to pay to look at Daily Mail articles. So, but what I will add in is the caveat. So I can understand, although I don't like it, I can understand some aspect, although I don't. Although if all I would say is if the NHS is running a service right now, you should never privatise it. But I can understand politically where it comes from. But there is a difference between doing that and then allowing, as you've described, contracts which are utterly ludicrous. You know, at the end of the day, you can't have a situation where 10 years down the line, the running costs as a result of these contracts mean that because it's almost like they must have thought to themselves, well, we'll just keep growing the economy and it'll work out. And it's like, but did you never think that at some point the Tories are going to come back in?
Yeah.
So it's like a strategy based on the fact there's no such thing as a Conservative Party. So it's like, you know, it's a strategy not based on reality.
You have to future-proof it. You have to make sure that it's so good that the Tories can't possibly get rid of it. Like
but
we
there's
did
no
with the
such
NHS.
Thing. There's no such thing.
Like what America did with the Affirmative Care Act. Trump wants to get rid of that. He couldn't because it was too good. I mean, it's not great, but like he can get rid of it.
Well, you say that if they let him back in November, he'll get rid of it. He'll get rid of a lot of things.
Well,
because there'll not be any need for any more elections in the future.
No, that's very true, and very sad.
Have you heard? He don't want to. He reckons he won that debate earlier this week. Oh, he won it easily. And then he was asked, so when can we look forward to the next debate? Oh, I'm not doing another one.
Oh, he's won it.
He's ruled out doing another debate with Harris. Apparently, he doesn't. He's maybe thought on it. He's maybe thought to himself, maybe it didn't go as well as I thought.
We've got some chat coming in. We've got Nick saying Labour need to ditch the economically crippling Brexit red lines, in inverted commas, giving the economy and government coffers a huge boost, regaining access to large numbers of key NHS workers from the EU. Are they red lines? Like, are they?
Well, the thing is, they are red lines. He stated them as red lines, but your political red lines last for one parliament. They last for one parliament. And the fact of the matter is, I know there are some people, and I really would like to know, maybe you can ask Femi why he's doing it, for example. I would love to know, in all seriousness, why some people are saying Keir Starmer has the option of just joining the single market when there is no process. There's 3 ways to join the single market. The first one is to join the EU, which we cannot do. Even if he came out and said he wanted to do it, we cannot even start the process just yet.
Well, why don't we set up, Phil? You can have this chat with Femi next week. We'll set it up.
Okay. But the second way is to join EFTA, which is not, they don't want us to join. I don't blame them. And it's not in our interests either. And then the third way is to ask the EU and EFTA, because they get a say in it as well, if we can have our own bespoke deal, which would take 15 years to negotiate and would need unanimous support from not only every single EU member, but every single EFTA member, because they get right of veto on this. Because actually, ironically, the single market is sort of almost as much that it's not really because the EU decide the rules of it, but EFTA have a deal where the EU can't just let anyone into it without their say so, unless they're joining as an EU member. So that would take like 15 years to negotiate, and in reality, no one would take those negotiations seriously because the Conservatives would instantly say, as soon as we come back to power, we're going to trash the whole thing. They've already said that. So why would anyone in the EU or EFTA take it seriously? Because they'll think, well, it's going to take 10 or 15 years to negotiate, because you'd have to negotiate the terms because it's a completely bespoke deal. It doesn't actually exist anywhere else in the world. And there'd be lots of quibbling over all sorts of things, not the rules, because we'd have to accept the rules, but over like contributions and various things like that. And, and there's a fair chance, you've got to at least assume that in the next 15 years, the Conservatives are coming back and they'll just trash the whole thing. Why would you waste your time? You wouldn't. Yeah. So anyone saying that Starmer has the choice of just joining the single market, it's where we need to move towards. But if they're saying it as if it's actual political choice right now, they're lying or they're naive. I don't think some of the people saying it are naive. So therefore, they're lying for some reason. And I'd really like to know why.
Femi's going to be appearing on a panel with us, along with Peter Keir of the National Rejoin March, a week on Monday in Liverpool, if you're about, at the Ship and Mitre at 7:30. So please get along to that. And we might be getting Mike Galsworthy, but Mike's been talking to you more this week than he's been talking to me. He said, he got back to me. He said he just has to check with the missus if he can come and speak on our panel, and he's still checking, I think. But yeah, I mean, I think that Femi really doesn't like Keir Starmer. Like he really doesn't like him, so he always will assume the worst of Keir Starmer. He's so much so that I don't know if you're watching this, Femi, but when I was chatting with him once about this, I said, "Well, what about all the human rights work that he did? Going around the world, getting rid of the death penalty in different countries." And he's like, "Oh, he only did that for himself." I was like,
"Right." So, well, here's the thing. Okay, I mean, not everyone is balanced. I don't claim to be, but I'd actually trust someone more that hates all politicians than follows any of them blindly like a cultist. So I'd actually prefer that. So it's a bit like Ian Hislop. I sometimes criticize Ian because he just hates all politicians. It sort of blinds him a little bit. But that's better than having blind faith in one. I don't trust any politician. I don't care. The issue of whether I like them or not is irrelevant. I've not met very many of them.
Do you not think that things would have been like so much better had Jeremy Corbyn been Prime Minister? He was great.
I mean, they've been better than Boris Johnson.
Oh, mate, did you hear the story this morning? It was about what's the name? The MP went out with for a bit.
Diane Johnson.
Diane Abbott.
Diane Abbott.
Yeah.
Diane Johnson, the one who got a purse next recently. Sorry.
Oh yeah, was that the one who got the purse next at the police conference?
It's a police conference.
This is almost
technically it was in the hotel.
This is almost funnier than this. So Diane Abbott and Jeremy Corbyn went out for a bit, and she said that they split up because essentially he was just obsessed with politics. Like he never had any time off, and apparently he said, "Look, I'm going to take you on a date." So they went out. She got all dressed up, put makeup on, and everything. Didn't know where they were going.
Tomb of Karl Marx.
Yeah. He took us to the tomb of Karl Marx.
Yeah.
Oh my God!
Well, I mean, maybe
there's politics wonks, and then there's.
Well, he maybe was a fan of porridge.
Why is that? What happens in porridge?
In porridge, not in porridge, but Fletcher's relaying this story of how his first child was conceived at Highgate Cemetery at the tomb of Karl Marx.
Oh right, okay. Maybe he was
he thought it was a romantic beauty spot based on his television view.
That's just not normal, is it? Come on.
I don't know.
It's
weird.
Political. It's weird. It's someone who's not very good at being, integrated into society.
I don't know. I don't know that I'd be that critical of that. At the end of the day, it's it's a politician taking another politician out. They probably thought, well, this is.
But I want to go back to talking about the government debt and borrowing and all this. It's all bullshit. Like they're borrowing off themselves, and if they can afford the repayments, what's the problem? It's like
the problem is that you lose the next election because what happens is your national debt. Because I'll tell you what's happening at the moment. If you read the Financial Times at the moment, like there's article after article about what Rachel Reeves could do and what she might be considering.
Yeah,
and all of it, none of it is about how people think the budget works. None of it, like people think the budget works like a household budget. Like this is your income, this is your outgoings, and you do things to make your outgoings equal or less than your income, right? But all of these articles are about how she can basically redefine certain terms because it's like, yes, money doesn't really exist, and the government, to an extent, basically control the money, and the Bank of England, under their supervision, control the amount of it.
I would argue, you're saying, but the newspapers will slay them. Yeah, but if people's quality of life goes up, surely that will counter. That'll counter any people saying, but this is a bad thing, because they're not even talking about the government debt in America now during the presidential.
That's because Trump's an idiot, though. I don't think we can point.
Both of them are not talking about it because no one cares anymore. No one cares about the government debt over there?
It's not because no one cares. It's because Harris doesn't want to talk about it and Trump isn't talking about it. You can't point to a dysfunctional election campaign and say that, hold it up as an example.
No, I mean,
no one's talking about it because Trump is an imbecile.
Surely, if Trump's got people behind him, he's got JD Vance
and he's not listening.
Nobody's talking about the national debt. He's talking about the bad economy. He's talking about job figures. He's talking about everything else. Well, he's not. He's talking
because
about
he doesn't want to.
But he's not talking about the national debt, and that used to be a huge thing.
He's made a point. He's made a point of saying that he'd even told one rally that they're telling me to talk about this, that, and the other, and I don't want to. Do I have to? He's not doing.
I mean, aside from Trump, but you've also got other people talking on his behalf, like the talking heads on Fox News and JD Vance. They could be talking about it. They could be, well, have you seen how much the debt's gone up under Biden?
He's an idiot.
But even
so, pointing at imbeciles.
They're very well funded imbeciles. So at least. Maybe
but they're not,
the people funding them should get on the phone and say, hey, why didn't you go on about the government debt? Well, I think they've done that. They've thought about it and they've gone, it doesn't really, no one really cares.
They haven't thought about it.
What, you mean that people would care if they thought about it more?
Yeah, they haven't thought about it. They're not paying attention to data. These people don't like data. They're just imbeciles.
Okay, so why would they care about our government debt then in 10 years' time?
Vance won't have been talking about anything yesterday because apparently it was World Dolphin Day. He'll have been otherwise engaged.
Dolphin couch day. He jumped the dolphin on the couch.
But we know this happens because this is what the Tory media have talked about. They've done it. They did it with. Why did the 28 billion pound?
Stupid politicians here as well.
No, because they knew how to do that. The 28 billion pound green investment. Why did that end up getting scaled back? Because it's exactly what the Tory press did. They worked out how much it would add on to the national debt. They assumed zero return, and they said, this is what it will cost you. They did several things. So we've seen it in action this very year. They worked out, £28 billion a year. So they worked out as if all of that would be borrowed and with zero return. They then worked on the assumption that the way that debt would be serviced would be in the form of income tax, and then on the lowest rate of income tax, because they assumed, because they did it, this is what it will cost per household to pay back, and they came up with a figure, this is what you will pay extra in taxes. And the reason why it's more of a problem now is because at the moment, the cost of servicing debt is just going up. Yeah. It's increasing all the time. So, and we've seen it in action. It's not like this hypothetical thing that maybe was true 20 years ago, and maybe if Labour just tried it, maybe it wouldn't happen. It did happen. It happened this year, a few months ago. And that was just the 28 billion pounds. Imagine doing it for 200 billion pounds a year.
Yeah, yeah. But I mean, look, if you can service your debt, like Japan's been running at a sort of 139% deficit for the last 30 years.
No one has that discussion. The media, the Labour politicians, first of all, most of them are very poor communicators. And the ones who are not, because they do have some that are good communicators, the ones who are, everyone sees them as this one source. It's a Labour MP, it's a Labour MP, it's a Labour MP. Whereas they say, oh, there's the Times and there's the Telegraph and there's the Daily Mail, there's the Daily Express and the Sun, and they think they're all very different. And there's the BBC and the ITV and Sky News. And then you've got other political parties, politicians of Reform UK and the Conservative Party and the Lib Dems, and they'll all say quite similar things on this. So, the ordinary member of the public is listening to a Labour MP saying one thing and like a dozen other people saying another. Who are they going to believe?
But I mean, that's what they're up against with anything. You may as well just say, they shouldn't come up with any policies because they'll just be crucified by the newspapers. Of course they will. That's what the newspapers are going to do for the next 5-10 years.
But that is why the policies they come up with, they have to come up with policies that are so complicated for the Tories to try and argue against in the press that it doesn't work. They did. What was that? There was one that they did that with. Oh, I've forgotten what it was. And it was just too complicated to get through to people why it should be a bad thing. And I've completely forgotten what it was now. But that actually did. That's annoying me now. That did actually happen as well in the lead up to the election. They were trying to bash some Labour policy, but it didn't. But it was too convoluted. It was too convoluted, and that's what you sort of have to do.
Okay. I'll go with that.
But, you know.
We've got some comments coming in. Scott Walton. Sorry, not Scott Wilson. Scott Walton, thank you very much for the £5 super chat. Did you hear Jeremy Corbyn as PM would have brought about peace in the Middle East?
Yeah. I'd have been happy if it had brought peace in this country, but I'm not sure he would.
Nick says it won't take 15 years to get into the EEA via EFTA. It's a much lower bar than fully rejoining the EU. Copenhagen criteria for Latvia's commitment to the euro, etc. Focus needs to be on EEA for now.
EFTA don't want us. And I believe that. And you could argue, because there's a lot of things going around, like, you know, just because, like, people are pointing out, oh, you've got these EU officials saying, oh, they don't think Keir Starmer is even serious about a reset. And it's just like, well, first of all, that's just officials. And second of all, so they could easily just be saying something to, like, browbeat, you know, the government in this country. So, you know, you always have to take it with a pinch of salt when someone who's clearly on a side of something says something.
Yeah.
But I believe it with EFTA because our economy is larger than all the rest of them put together. And, you know, so we'd be like a bull in a china shop.
Okay, well, can you address this then? So Nick replies as well. People need to stop making excuses for Labour's red line or even criticising them, or not even criticising them, because the UK can't rejoin the single market next Tuesday. Again, Labour are sending the wrong signals to Europe. So can we read between the lines there and go, well, are they? I mean...
So, well, they could be, but the bottom line is, at the moment, Keir Starmer says he wants a meeting with the EU Commission President, and she's not setting one up. So, at the end, if they're getting the wrong messages, then he can, you know, he can talk to them, and he can just say to them, we'll set up a meeting, and we can make sure you don't have to get our position from, like, the Daily Star or something. Not actually, the Daily Star is probably one of the more decent papers these days. But, you know, but you don't change that, because again, what people need to understand, it's not criticizing it. It's just accepting the fact that at the moment, a lot of people, like when you hear things like, oh, but there's a majority who want us to do this or that and the other, it's like, no, there's not. Oh, but there's this poll. Yeah, but that poll doesn't explore how you do it. It's what I call magic wand polling. You ask people, would you like this to be the state of affairs? They go, yes, we would. But then if you ask a poll, okay, would you like if this? Then you ask a poll that says, right, this is the journey.
Do they have to be Polish, or can you ask anyone?
No, you can ask anyone.
Okay.
And you ask them for the journey. Oh, well, it would mean doing this, and all of a sudden that lead goes down. So in terms of should we rejoin the EU, majority say yes, or at least way more say yes than no, because there's sometimes quite a lot of don't knows. But then you ask, and this has happened, the polls have done this, not the polls, polling companies. You ask, do we do it if it means giving up the pound? All of a sudden, oh no, we shouldn't do that. And the same applies with just trying to join the single market. It's like, should we say we want to join the single market even though we can't do it now? You're basically asking a government to say we should do a thing and then own up that it can't do it. So
you don't need to. I mean, look,
we need to do it by.
I think there's a middle ground here. Okay, you can not say that you're going to do something, but you can not say that you're going to. I mean, like,
but then,
they've said this is a red line. They said there's no chance. We're not even going to think about it
because they know. Right. So here's the situation. They know they've got their own polling, which is way more detailed than public polling, but it's in line with public polling as well. So here's the situation. So you have a load of people who say, well, we should join the EU or just the single market, whatever. They don't realize there's no way to do that. So you say that. Then you say to those people, is it going to change the way you vote? Not really, no. And we know that from polling. Then you say to people who don't want this, and there's two reasons why people wouldn't want it. The first is because they still support Brexit, right? The second is because they did so much damage to their relationships during the Brexit years, they don't want that time revisiting with another toxic debate in public. So those people really don't want it. And you say to those people, would that change the way you vote? And a lot more of those people say yes. So saliency has to be taken into account as well. And these are all uncomfortable facts that they have to be faced up with. My attitude is not, let's just sit back and just hope that somehow the public changes its mind. No, not at all. I want to be much more proactive, but I want to be proactive by instead of working on the assumption that Keir Starmer, who was the biggest anti-Brexit voice in this country, basically, until we actually left the EU, working on the assumption that somehow a head kicked him in the horse, as well as the rest of his cabinet, because they were all anti-Brexit, or not all, but majority of them were anti-Brexiteers as well. Instead of working on the basis that the politicians are just being spiteful for some reason, work on the basis that actually it's caused by public opinion and electoral reality, and work on the public opinion. And how can we do that? What is the best way? Because what we need to do, we don't necessarily need to increase the number of people who think we should join the EU, because that's already quite high. It'd be good if it was higher. What we need to do is to increase the salience of it.
What does
and
salience
no one's
mean?
talking about
Sorry,
that.
what does salience
Saliency is about how strongly people feel that. At the moment, it's not at all. You know, people say, oh, Labour are going to lose those votes. No, they're not. They know they're not. You just think that you just want them to. They're not going to.
Yeah. But
So
at
you
the same
have to
time,
do
you
that.
can't say that we don't need more people voting for it. You've said yourself in the past that we need
we always-
conservative
you do need
voters.
more.
We
But-
need Brexit voters to realise they've done something wrong. There's something very
But
horrible.
ultimately, there's
to this
already
country.
a fairly sizable group of people who think we should. If it's like click a button, we can join the EU, they would click it.
Yeah.
But how do you increase the importance of it? Because a lot of people are thinking, yeah, but it's more important to sort out the economy and the NHS and housing. And we're
It's
just
all
sat there going,
connected.
all of this is easier if we were in the EU.
Yeah, exactly.
Right? So what do you do about that? You have to get people to see just how serious being outside is.
Yeah.
Best way to do that, economic impact assessment. So what we should be doing
Yes, I
is
agree
hammering
with
the
that.
government. Because
But
think about it.
also, the Labour government need to bring in a Brexit tax. And when they say, but you said you weren't going to bring any new taxes in, they say, it's not a new tax. We're just pointing it out. So everything you buy, you know how much Brexit has cost you. Every time you buy a chocolate bar, you will find out just how much extra Brexit has cost you. And that would be great. I think that would be a
I don't think
wonderful
that'd be too feasible.
way of getting
But-
people to get it through their thick skulls that we have literally doubled the price of everything because we have doubled the time it takes to get the stuff into the country.
But
And time
I
is
think-
money.
But listen, think about it as well from a minister's point of view, Keir Starmer, whoever. A minister's point of view, right? So let's say you've got someone going on and on. There's all these people that are the voice of the Rejoin campaign. And what are they going on? What do they want them to do? Just join the single market. Well, they're thinking to themselves, yeah, but we can't. So what do? You dismiss the whole group as cranks. Well done. You've now made the Rejoin community cranks. Whereas if that community says to them, we want an economic impact assessment on being outside the single market, being outside the customs union, at the very least, then you can't dismiss that as crankery, because not only can they do that, but they'll sort of know they really should do that.
Okay, so impact. We need an impact assessment. Well, I'm going to be at the Labour Party conference next week, so I'm going to be, not the week after, so I'm going to be asking for an impact assessment, which we didn't have for the winter fuel.
We've never had.
The winter fuel allowance. We didn't have an impact
no.
assessment, Phil.
But
But the
think
Tories
people
who are always really good at having impact assessments are complaining about the fact there's no impact assessment.
You say
Is this
that,
the same?
but
Is this the same Tory party that brought in the Kamikaze budget without the impact assessments?
There is an impact assessment. What people are pointing out is there isn't a specific impact assessment for this specific
It's for the
policy.
winter
but that's
fuel
because
payments.
It's part of the budget. There is going to be an economic impact assessment of the budget.
Right.
Because Labour are actually bringing in a law to make it mandatory anyway.
Yes.
But also the only Prime Minister who ever announced a budget without that since the OBR was formed was Liz Truss. And Labour are actually bringing this law in as an antitrust law. So there will be an economic impact assessment. It's just not of one part, it's of the whole budget, because this is part of the budget.
Yeah. Well, just to go back to the NHS where we started. Ivan said a little while ago, he said, because of the Tories, I now had to go private for my mental health treatment. It was costing me £200 for each appointment with my psychiatrist. It's now been put up to £250 for each appointment. Like, how are people supposed to afford that?
The thing is, you can't always get it as well. I mean, I've known people. I mean, this is a problem, and this is what happens as well.
Sorry about that, Ivan, by the way. That's really fucking sucks.
But there's some people who, even when they try and do that, find that there just isn't the capacity anyway.
Yeah.
I've known people who've needed mental health care, and it's like, well, we'll have to pay for it then. and then can't find anyone. It depends where you are. If you're nearer to London, I suspect it's easier. But I mean, another thing that happens is, and this is where you have, you know, Reform UK want to make the term two-tier popular. Well, here's another two-tier aspect to the NHS. So you're struggling to get a diagnosis, as for example, our stepdaughters have. So what do? Well, if you can afford it, you get a private investigation. So then the private doctor finds out what's wrong. They diagnose, at which point you don't need to pay for the treatment. You can go to the NHS because now you've got a diagnosis. So now you can get treatment. So it's a way of jumping the queue if you've got money.
Yeah.
Because a lot of the hold up is getting the diagnosis in the first place.
Yeah. Well, I'm still waiting on my diagnosis for ADHD. It's been 8 months. No, God, fuck, it's been 10 months. 10 months I've been waiting. And they reckon I'm going to wait at least another half a year. And that's from Right to Choose or Right to whatever reply or whatever it's called, which is a private function of, it's paid for by the NHS, but it's supposed to be private. And yet their backlog is so huge. And even if I do get a diagnosis, getting the drugs, getting the medicine, that's another issue that's been thrown up by Brexit, which we said would happen. Yeah. It's made it much more difficult to get your hands on these medications.
I keep saying at any one time, there will always be some problems with supply chains. At any one time, like you look at France, at any one time, there's usually about 20 drugs not available. Was the case in the UK, but now it's about 100. I think last I checked, 160.
Yes. And people are having to travel the length and breadth of the country just to fulfill prescriptions that keep them alive. You know, this isn't something that's completely unnecessary. That would just, you know, and the stress that is putting on people, not knowing that medicine's coming in. Think about it. Stress manifests itself in a physical way. When you're stressed, your body fucks up, and it's again, it's the Tories, their old tricks of doing stuff to save money. Apparently, that ends up costing us more in the long term. Alex is saying my ex had to wait 3 years for ADHD. Ivan says thanks for the kind words. No worries, mate. I'm really sorry that is an absolute disgrace. I hope that Labour turn things around because they have been quite proactive about mental health and about what they're going to do.
Yeah, well, I think
mental health. So go on, Phil. Rain on my parade. Fine.
Sorry.
Whatever.
The emphasis when you look at the mental health stuff, and it's one of these things where I would say, in terms of like state provided mental health, we pretty much have none. I know there are some NHS psychiatrists, but we pretty much have none. And the emphasis is on like young people. So it's like they're building up for young people. So I think it will take a very long time before we have an adequate mental health system in this country. Because, you know, if you look at with the mental health provision, a lot of the actual policies in the manifesto are things like the community hubs for young people, mental health, nurses in schools, stuff like this.
Yeah.
Which is, you know, arguably a good place to start because young people are facing like mental health pressures like never before.
Yeah.
But nonetheless, I don't think it's going to be, you know, a thing where an adequate mental health provision is rolled out across the country in the next few years. I think it's a case of they're starting on young people.
Yeah. And
we'll just have to see where it goes.
Ernie Burns is saying also my local supermarkets have huge spaces on the shelves. No one mentions that anymore. Yeah, because it's amazing what you get
and
used
also,
to.
And there's a couple of other tricks as well. First of all, sometimes aisles are just moved. So you've now got more space between aisles. And also some other products for which there's plenty, they just put more of those on instead.
Yeah. Yeah. But also, I mean, I've noticed that we have to time going to the supermarket quite cunningly. So early morning, Thursday or Friday, early morning is the best time to go. Well, if you go later in the day, go at the weekend, forget it, mate.
You'll be lucky then that your supermarket's regular because in most you can't tell because supplies can be irregular as well.
Yeah, that's a point.
So and these problems. I'm just reading thing here from the Nuffield Trust. This was earlier this year. Patients face new normal of medicine shortages as UK hampered by supply issues and impact of EU exit. And that's the thing. You know, there's no end of people who worked in logistics for many years before we joined this, before the single market was a thing, and while we're in the single market, and then since. And these people are all saying the same thing. We're just going to have to get used to not having as much, being able to get as many goods, not having as much choice.
Yeah.
Because there was a time before the single market where certain products that are on the shelves all the time now used to be like a Christmas treat, because it wasn't, it was too difficult to get them into the country. And then the single market completely changed everything. But now we're trying to behave as if we can still have that choice.
We got used to it.
And we're still used to it.
We thought that was normal, and it's not normal. Yeah. I keep telling people this. What we had in the EU was not normal. No other country in the world had it. No other country in the world had what we had in the EU. Even the other EU members did not have what we had in the EU. We got to keep our own currency. We got to keep our own antiquated system of democracy. We got to keep out of Schengen, and also we got a massive rebate on the money we paid into the club. No one else got that. That was nice, wasn't it? But I mean, Anthony's asking a question, and he's asking, does the winter fuel allowance now go back to ping pong with the Lords defeating it? I'm a bit confused because they had a vote on it.
No,
because it was a statutory instrument, wasn't it? Can you explain this?
So the Lords never get a say on money matters. I know a peer was supposed to be introducing a kill motion. So in theory, because it was introduced via statutory legislation, because although it's going to be part of the budget and the budget has to be voted for by the House of Commons, but it's never voted for by the House of Lords. Money's got nothing to do with them. But because they want to introduce it for this winter, it would be too late to wait for MPs to vote for the budget. Yeah. So they've introduced this specific measure via a statutory instrument. Now, because that doesn't require any reference to Parliament, that's like a minister changing a regulation. Now, bear in mind, the Conservatives used SIs to actually create completely new criminal offences in the last Parliament, which is a very dodgy way to use it.
Yeah.
But in this case, it was just like changing regulation. Yeah. And in that instance, the House of Lords is able to say, oh, well, you don't seem to have MPs' permission for that. Other than the ones who are ministers.
Yeah.
And we don't like it to the point where we are going to sort of kill it off. And what would happen if that vote succeeded, then the statutory instrument goes away. Then the government can still then reintroduce it, but it would then take time because they'd basically have to get like permission from MPs, which would basically mean... So all it would do is stop it being introduced this year.
Yeah.
But, okay, some people will think there's reason enough to do that. But that's it. And in all likelihood, peers are probably not going to do that because it's a money matter, and the Lords isn't supposed to vote on money matters. Okay. They're not supposed to vote on money bills. So I think a lot of peers, even if they're opposed to the move, will say, but actually the government have the right to do this. It's not an abuse of SIs to do what they've done. You can disagree with the policy, but the government haven't actually done anything dodgy.
Yeah.
And it would therefore potentially be dodgy to counter it, even if you think you're in the right.
Yeah.
And also, if they do it, if the Lords do anything which is taken by the government, especially a government that has plans to abolish the House of Lords, it might just make Keir Starmer say to his cabinet, this is a good reason for accelerating my plans. Because at the moment, I mean, remember, Keir Starmer wanted to abolish the House of Lords in one Parliament. It was like opposition within his own party that went, oh no, let's just slow it down a bit, shall we? Not the least of which were people in Labour in the House of Lords, unsurprisingly.
Can I just stop you 1 second? Sorry, there's been a disgraceful slur in the comments here that I'm not going to stand for. Sonic Shadow 191 saying, Josh, there's never a demand for parsnips. ... Minging. What have you got against parsnips, Sonic Shadow? I love parsnips. I make fantastic roast parsnips, I have to say.
I do as well, and I hate them. But
you hate them?
I absolutely hate them. I hate most vegetables.
Sweet potatoes? Do you hate sweet potatoes?
Yeah. Almost every vegetable.
Best.
Almost every vegetable I hate.
Oh, so you're not a
probably because I'm
vegetarian?
psychologically scarred. It would be very difficult for me to be a vegetarian. I'd lose a lot of weight.
Were you forced to have them as a kid? Were you forced to eat them?
Yeah, I think my parents went around it very badly.
Did they boil them so they just tasted like solidified fart?
There was also that. But even
you can make them
it's not
nice,
the problem.
Honestly.
No. Because I do roast things properly, and I do, and everyone raves about them, but I still don't like them.
Vendetta's joining in now. Vendetta's saying parsnips are weird. Vendetta, you just take that back.
I am actually going to be making parsnips next week because, so my partner has basically got like diabetes now. She knew she had it before, but she's now finally had to own up and go to the doctor. And they've looked at her blood test and gone, yeah, you're off in the meds.
God, Alex French is saying that Sonic Shadow is right. Why is everyone ganging up on parsnips? What have parsnips ever done for you? Sorry, Phil, I interrupted.
I was just going to say, potatoes a bit of an enemy. So I'll just make her roast parsnips and carrots.
That's fair enough.
Without the honey, I don't imagine that'll do her any good.
No, you don't want any
so I'll do
honey.
it without the honey.
Yeah. But parsnips are great. Honey roast parsnips are tasty. Thank you, Christopher.
Vendetta's saying Phil's a typical
Thank you.
Yorkshireman.
You rescued the chat.
Vendetta's accusing me of being a typical Northerner who only eats beige food. Parsnips are beige. I still don't like them. And my potatoes are not beige when I'm done with them. My roast potatoes are awesome.
I do enjoy
And
making my dishes colourful. Like when I make chili con carne, I've got to use I've got to throw some corn in there, a nice bit of yellow, and then I have some like pepper.
I put pepper in myself.
And then
I don't mind that. I don't like the
greens.
kidney beans though, so can only eat my own chili because I don't like kidney beans.
You don't like kidney beans either. Oh my God!
You're saying that surprise when I've already described
when I say that I'm an omnivore, Phil, I'm an omnivore. Yeah. I literally eat anything.
Well, that's just as well, given that you've travelled the world.
Well, yes, I've tried some things that I'm never trying again though. You just try it once and then never again. Ban parsnip adverts till after 9 p.m. So we got a couple of minutes before we go. So there was literally someone who called up the radio this morning on LBC to say that the government shouldn't ban adverts for unhealthy food before 9 p.m. because if you're going to do some exercise, it might be better for you to eat a bag of crisps than to eat an apple. And I'm listening to the radio going, this has got to be a wind-up. This has got to be a wind-up.
Surely it was.
Do these people walk amongst us?
Oh, yeah, there are plenty of thick people in the world, but I mean, I'm surprised at that thing. Someone else just said regarding my wife, you can control your diet. No, she did do at one time. So this is going back a long time. And she did initially reverse. She was pre-diabetic, and she did reverse that with diet, and it lasted for some years, and it doesn't anymore. And, so the last couple of times when she's done the low-calorie diet, it hasn't made no effect to her blood sugars. So she's just got it. That's it. Obviously, she is still going to have to make sure she's having a better diet.
Yeah.
It probably wasn't helped. I did point out it wouldn't have been helped the fact that over the last couple of months we've had quite a lot of things that are very bad for diabetics in the lead up to the wedding.
Is it type 2? Type 2 diabetes?
Oh, yeah, type 2.
Yeah.
Type 2.
Yeah. That's what my dad had. Well, I mean, he's
got,
still
all
got
her
it.
family have got. All her family have got it.
Yeah. Once someone's that far, my dad's got dementia. Once someone's gone that far with dementia, they stop with any of the other supplementary drugs that they were taking. It's too hard to get them to eat them usually. So we stopped on the diabetes medication about 4 years ago now. He's still with us. Ivan, thank you very much for the £20 super chat. That's very kind of you. The NHS Trust for Mental Health in my area, Norfolk and Suffolk, NHS Foundation Trust, is the worst mental health trust in the country. The Tories have unsurprisingly ignored it, including the deaths of thousands of patients.
That's Liz Truss's neck of the woods.
It is. Well, not anymore, mate. She didn't win, did she?
No, not anymore. That's true. Yeah.
Now she's homeless. She's just sort of wandering around the world, pontificating and getting very upset if people make fun of the fact that she destroyed our economy. But yeah,
Led by Donkeys have got an exhibition at the moment. The Telegraph gave it 2-star review, and they said they were disappointed. They were hoping for a 1-star review. And it's got in this exhibition like the lettuce thing that upset Liz Truss.
Oh, fantastic.
As well as a few other things.
Jesus. Parsnips are not weird, says Leapshin. But yeah, back to what Ivan was saying about the Norfolk and Suffolk NHS Foundation Trust being shit. I mean, again, postcode lottery. I mean, there's so many. I mean, I remember this was years ago. This is probably still under the Labour government at the time. But I remember listening to Ben Goldacre talking about Dr. Ben Goldacre. He's the guy who wrote the book. I think you'll find it's a bit more complicated than that. And he was talking about health outcomes and the fact that in Glasgow, there were two suburbs of Glasgow. One is very working class. Right next door to it, it's very middle class, very upper middle class. And the life expectancy between the two, the difference is over a decade. A decade. It's like 5 minutes walk down the road and you will probably live 10 years longer statistically than if you...
Still, if that's Glasgow, that's probably still only just making it into their 60s.
But yeah, I mean, when you look at health outcomes and the fact that there is a really disgusting postcode lottery in this country, and I'm all for the ban on selling junk food, just so I don't have to listen to those bloody Domino's ads anymore.
Oh, I mean, I don't watch telly, so I don't care about the ads.
No, they're on YouTube. They're on bloody YouTube, every video. I'm trying to watch your videos.
I don't get those ones, funnily enough.
Domino's.
See, I'm the one who looks like I eat Domino's.
I keep holding down the little eye in the circle, Phil, and saying, I don't like this ad. Don't show me this ad. Right. And then the next video I watch, it's the same freaking ad.
Well, maybe that's a weird one. That it's obviously taking the view with you. Methinks the lady doth protest too much.
Do you know what? I bought a drain cover, a plastic drain cover the other day, right? And now every single one of my adverts that I get when I'm scrolling through a news site is for drain covers, and I'm like, it's all right. I just needed the one. It's fine. I'm not going back for some piece.
We know how it works.
Maybe get an extra one spare.
This morning, my wife was looking on the local for sale Facebook group, and someone had knitted some pumpkins. Right, I don't know why you'd want a knitted pumpkin, but each to their own. So she was looking at DN17. I thought, that's familiar. She says, "Is that where you Scunthorpe?" I said, "Well, that was DN16, so it can't be far away." So she started to put in her phone, "Where is?" and it automatically filled in DN17.
Wow.
All she'd put in is "Where is."
Well,
so
that's not as freaky as a few years ago when I was working in the back garden with my nephew, and we were listening to Radio 6, and we were just talking about music in general, and mentioned Soundgarden and how sad we were that Chris Cornell's no longer with us, and we both started talking about Spoon Man, not the most famous song, which is Black Hole Sun, but Spoon Man specifically, and as we were talking about it, it came on the radio. That was weird. Yeah. Maybe we're living in some kind of what's his name? Truman Show. Maybe we're living in the Truman Show. Maybe. It's listening. We're being listened to.
Well, we
BBC
know
Radio 6. Stop listening to me.
We know we're being listened to. We know it. Alexa's listening. The phone's listening. They're all listening. It's
just one of those moments where you're talking about a song and then both of you stop talking. You go, it's just the radio. But yeah, that happens. Anyway, so before we go, Ivan says there needs to be maximum pushing. It's gone. Sorry. I just pushing and noise for getting people to the government to take these issues seriously. But I do believe, and come back in a year's time, but I do believe that Labour, the vast majority of those Labour MPs who have been elected, have their hearts in the right place. And
when it comes to the NHS, it's always a given. It's always a given. No one joins the Labour Party that doesn't think we should have universal healthcare free at point of access, because it's one of the few things that unites literally everyone in Labour, that if you do not have effective healthcare, that means it has to be quick treatment, effective treatment. Your economy will not work. It's no one inside Labour does not believe that.
Yeah.
So they will always do. Now, that doesn't mean to say they'll always do it in the right way, but it does mean that they will improve outcomes. It's like, we can criticise some of the things that Labour did, like PFI and the last time, but they still made the NHS the best healthcare system in the world.
Mm.
Just a little ticking time bomb of debt. But they made it the best healthcare system in the world. The same, I don't know whether they'll make it the best healthcare system in the world this time round. We might be too far behind. But they will make it way, way better. Even just Wes Streeting just saying, the waiting list is going to be down by millions by the next... Because there's a lot of emphasis on this 10 years of renewal, a decade of renewal type of thing. Whereas they also know they can't just have 9 years of, it's nearly there, it's nearly there, nearly there. There it is. because there's another election in between, potentially 2 elections in between if they have it after 4 years. So, the fact that they're even saying, oh yeah, the waiting list will be down by millions, just off the cuff a remark like that, means that they're completely convinced that that's what they're going to do.
Well, someone's put in the chat about Labour need to be more joyous.
It would help.
Yeah,
I think it would help.
In this week's Private Eye, they've got a WhatsApp conversation between Angela Rayner and Keir Starmer, where Angela Rayner says, "Happy birthday, Keir." And Keir responds, "No, it isn't. Now is not a time for happiness. There may be happiness in the future, but in the short term, we have to be realistic about the black hole of unhappiness that we've inherited from the previous government."
Talking about his birthday, do you know what happened? Everyone, went into it on Monday.
Said happy birthday.
Yeah, he had his morning meeting with all his staff, and none of them remembered it was his birthday.
Oh, mate.
I thought it was hilarious.
Should have come in with a badge saying birthday boy. That's what I normally do.
They all forgot. They all forgot it's his birthday.
Oh,
never mind. I'd have actually been secretly quite pleased if people forgot my birthday.
I think they should be a little bit more joyous, but they're being very much it's going to be this. It's going to get worse.
Well, they're basically doing the thing of this is all they're doing exactly what the Tories did in 2010 onwards. This is all Labour's fault. We're only doing this. We're only doing it because Labour made us do it. Except for them, they did it for 14 years. Yeah. Whereas Labour are thinking to themselves, we're doing it for like a year, and then we're going to be able to say, and because we did this is the difference. Because we made these tough decisions, now we can do this, and this. So from their point of view, it's like a waiting game. They're confident that it'll be turned around, but I still don't see the reason to take unnecessary hits. It's like, yeah, sure, if you're going to do unpopular things, you do it early on. Doesn't matter what happens to the polls early on, because you'll recover them as soon as you start showing the benefits. But at the same time, could you not? There are some benefits. It's not like their rhetoric is all doom and gloom, but it's not like all their actions are. So, all
right. Well, yeah. But Darren in Daily Blase, from Daily Blase is saying, it was my birthday yesterday, so happy birthday, Darren. Come on the show tonight. we're doing the Politics Social at 9:30 tonight. Captain Bart Roberts is saying that it was weird when he was wandering around Asda and Lost in the Supermarket by The Clash came out, which is a fantastic song. But come on, that's not that bad. If you were literally telling someone about the song Lost in the Supermarket by The Clash, then yeah. Nick says they can only blame the Tories for so long. Again, and this is repeated ad nauseum, the red lines are unnecessary. So you're not going to win with Nick. And do you know what, Phil? I kind of agree with Nick. I don't think you should have red lines.
It's really simple. Present the right message. Stop trying to tell the government to do something it can't do, or thinks it can't do if you don't think it's like that, and do something that they can't argue with.
Okay. Impact assessment.
Assessment.
What do we want? Impact assessment. When do we want it now?
Or when it's done. Any government that's trying to claim, as they are trying to claim, that they're going to be responsible with money and they're going to be open and they're going to hold themselves to account. It's like, right, so we should have impact assessments then, right? So where's the economic impact assessment for being outside the single market?
Yeah.
Because it's really, if you put that to them in a way they can't just ignore, because the first time you put it to them, obviously they'll just, well, if you just do it in the street, they'll just walk past you. They don't have to answer you, right? But, at some point they'll have to, and then they'll be evasive to begin with. But if it keeps coming, at some point they have to say something.
Yeah.
Remember, the only reason these red lines exist in the first place is because the media were asking them to begin with. They were trying to say nothing at all. Yeah. So these red lines developed over time only because people were asking them. So how do you get them to say something? You ask them the question. Okay,
well, I will do at the Labour Party conference, which runs a week on Sunday till a week on Wednesday. And like I say, we'll be there. Well, you feel you're not going this year, are you?
I'm not. I was a bit concerned about my feet, which are still actually a bit swollen.
But you are going to the National Rejoin March in a couple of weeks, right?
Yes. I may not be able to do the march itself.
Okay.
But we will see I will be there at the end.
And I'll be speaking at the National Rejoin March, along with some of your other favourite heads on sticks off this gobs on sticks off the internet. We've got a super chat just came in from Ivan. Thank you. I completely disagree. I will never stop blaming the Tories. Yeah, Ivan, I'm with that as well. I mean, other people might get bored of them blaming the Tories, but I won't, because I still blame a lot of things like happening today on Thatcher and Reagan from the 1980s.
Well, some of them are. You have to be fair. There are also, some. I don't think there's a lot that Labour are responsible for, but there are some things. So, I mean, I would say one of the biggest things I would say is not introducing proportional representation, where they had the complete mandate to not only do it, but do it in whatever way they liked.
Yeah.
Because then we wouldn't have had austerity. We wouldn't have had Brexit.
Yeah.
We wouldn't have had Boris Johnson or Liz Truss or Rishi Sunak. None of it would have happened.
He's right,
We would still have had Tory governments.
Yeah.
Because that's still going to be a thing, but it would be in coalition, and they wouldn't be able to just do everything a narrow interest group wants them to do.
Yeah.
Because the rest of them go, well, we're not going to.
Well, we're going to have to leave it at that because we're way over time. We're like 12 minutes over time. But thank you very much, Phil. And like I said, I'm going to be at the Labour Party conference the week after next, and the Politics Social live. The question is going to be: do all votes lead back to Europe? And that's going to be me and Peter Core of the National Rejoin March. Femi is going to be there, and I hope Mike Galsworthy. I don't have Mike's actual confirmation yet, but I'm hoping if he's in the city, he'll be there. That's going to be at the Ship and Mitre, upstairs at Ship and Mitre, which is a fantastic real ale pub in Liverpool. 7:30 till 8:30 we're going to be talking, and then after that we've got the pub for the rest of the night so we can socialise. And also it's Dawn Butler's Jamaica night on the Monday night, so we might go to that afterwards. So if that sounds good to you, keep an eye out, because we'll be I think tickets are going to be like £3. I've got to charge a little nominal fee just to cover the costs of hiring the place. But it's going to be strictly limited tickets. There's only going to be 50 people that we can sort of shove upstairs. So yeah, if you do want those tickets, keep an eye out, because I will be putting a link on this channel to the Eventbrite page for that. Okay, right, that's my advert over. Please join us tonight at 9:30 for the Politics Social, where we'll be joined by other people who might be even more lubricated than I am. And thank you very much for watching. Like I say, thank you very much to Phil for giving his time and his expertise in such matters. And until next time, I'll say thank you for the chat. Thanks for the super chats. And don't forget to give a like on the way out. And until 9:30 tonight, I'll say hello, good evening, welcome, and goodbye.